Hi, I'm Dr. Vidhya, Retina Consultant, working in Shekar Eye Hospital. Today I'll be talking about diabetes and its effects on the eye. Diabetes mellitus is mainly a metabolic disorder where, due to high blood sugar levels. It happens mainly because of decreased production of the insulin or less usage of insulin. The diabetes prevalence is very high in India. According to a recent study of Lancet group in 2023, it is estimated that 101 million people of Indians are having diabetes, which is almost 11.4% of total population. It could be increased almost like 120 millions in near future. Diabetes can affect different parts of the body along with the eye. Like people with high sugars can be at the high risk of developing stroke, and they might be developing more of cardiovascular complications also. It affects the kidney in the form of diabetic nephropathy. They might develop diabetic foot and diabetic neuropathy also. Most commonly, diabetic retinopathy. The prevalence of it is also increasing. According to the recent study, it shows nearly 12.4% with 4% developing vision-threatening diabetic retinopathy. So, any patient with diabetes has to undergo detailed dilated retinal examination at the earliest. Again, diabetes can affect different parts of the eye also. Like patients with diabetic can present with early cataract at the younger age group. It can cause dryness in the eye and it affects the optic nerve in the form of ischemic optic neuropathy, diabetic papillopathy. Sometimes it can cause central vein occlusions, and if the diabetes is not controlled and it has gone to little advanced stage, it can cause neovascular glaucoma also. Any patient diagnosed with diabetes has to undergo detailed dilated retinal examination. Based on the findings, they will be either diagnosed with no diabetic retinopathy or non-proliferative or proliferative diabetic retinopathy. Again, in non-proliferative, based on the clinical features, they will be diagnosed either mild, moderate, severe, and sometimes, if needed, they will be advised retinal imaging and OCT macula to rule out any diabetic macular edema. If they are diagnosed with any diabetic macular edema, they will be addressed with lasers and injections. And coming to proliferative phase, when the patient present with any bleeding in the eye or any abnormal new vessels and traction in the eye, they will be managed with lasers and if needed injections and vitrectomy surgery. Hence, any patients with diabetes has to undergo detailed diabetic checkups, eye checkups. And what are the warning signs in patients with diabetes related to eye? Any patients experiencing decreased vision with for few days or few weeks, experiencing dark spots or flashes, and decreased contrast sensitivity and experiencing flashes, they have to undergo immediately retina checkups. So please take care of your diabetes and follow up doctors with the periodic checkups. Please subscribe and follow up for more detailed videos. Thank you.